today on Health on Traxx. Beautiful looking Monday, I gotta say. 13th of January 2025. We are talking to Jasrinjeet Kaur. And we are talking about polypharmacy. First time I'm hearing of this, and this is how to manage multiple medicines safely, especially undergoing like multiple comorbidities and stuff like that. Then polypharmacy is something that you should be already familiar with. But if you're not, well, that's what we are here to talk about. Now, Jasrin is a pharmaceutical officer with the Cyberjaya Hospital in my very own little town. And Jasrin, welcome to the studio. How are you today?
Thank you. I'm doing really good today. Thank you so much.
All right. So today there is a lot to talk about. Now, today I will be the layman because this is a very new topic to me as well. Mm-hmm. We start off with the main definition of polypharmacy. What is meant by polypharmacy?
All right. Okay. So when we talk about polypharmacy, it's actually a condition when a patient takes more than 4 types of medication simultaneously.
Okay.
So it can be either to treat one or more diseases or any health conditions. Mm-hmm. So it can be any medications, over-the-counter medications, prescription medications, traditional medication, complementary medications. Mm-hmm. So there's a lot in it.
How about supplements?
Yes, that's also included.
Oh,
yes.
Okay, cool.
Okay. Mm-hmm. So polypharmacy, you can call it appropriate polypharmacy when the medicines are prescribed to achieve specific therapeutic objectives for a patient. That means it's really to treat their condition. Mm-hmm. So the goal is there. Mm-hmm. But there can also be inappropriate polypharmacy. That means that there will be excessive or unnecessary use of medications at one time. So usually patient can take more than 4 types of medications, but usually it doesn't justify why do they need to take it. It can be harmful for them. It can be unnecessary for them.
Toxic.
Yes, toxic, misaligned with their health goal.
Cool.
So that will be inappropriate polypharmacy. Okay, so our goal in healthcare will be to always reduce inappropriate polypharmacy and increase the appropriate polypharmacy. Okay, so usually appropriate polypharmacy will be considered at every point of initiation of treatment. Whenever the doctor wants to start medications for the patient, they will make sure that it aligns with the health goal of the patient across different health settings. Okay, and then appropriate polypharmacy will recognize a patient's benefit from taking multiple medications. So it depends on the patient's clinical condition, comorbidities, allergy profiles, any drug disease interactions. All the medications given will be chosen on the best available evidence. Okay, so it's very critical to distinguish appropriate polypharmacy from inappropriate polypharmacy. Okay, so other than that, it's not only based on the quantity of medication alone. So we can also, there's other criteria to identify polypharmacy. So for example, the use of medications without proper indication. Sometimes the patient does not need the medication, but he's being prescribed with it. Okay, example, maybe their BP is normal, but they're being given BP medications. Okay, and then use of medications with a therapeutic effect, similar mechanism to treat a disease, or maybe the use of medicines that have interaction with each other. So that can produce more side effects for the patient. Okay, and use of medications at inappropriate doses, and use of medicines to treat side effects of another medicine maybe. So yeah, that is all about polypharmacy.
Wow. So much to think about. Now, in my head, all I can think about, what if the side effect is the blood gets thin and then one more medicine, you take the blood gets thick, then what's the point, right?
Very complicated.
Yeah, so wow. And this is something that all of the pharmacists in not only the general setting, but also the private setting, they really need to take this into account.
Correct.
Okay, now I understand why pharmacy is hard. Why you all have to study for so long. All right, now let's talk about what might happen if a patient takes too many different types of medication at once. As you said, the minimum is 4, but then if they take more than that, what happens?
Okay, so usually, most of the time, patient can take more than 4 types of medication. It's no issues at all. But it has to be under a certain monitoring and then make sure it's indicated for them. So because certain medicines can interfere with the effects of other medications as well, like how you said, one medicine can make the blood thinner, another one can make the blood thicker. Okay, so among the adverse effects that can occur when patients take many different types of medications, it can be increased risk of medication errors. So from the patient itself, sometimes they have too many medications. So they tend to take repetitively, maybe 2 times a day. Supposed to take 1 time a day, but they are taking 2 times a day.
They overdose
Yes,
on
they
themselves.
overdose. Okay, and then non-compliance with the medication intake, because when they get confused, they are like, oh, I'm not going to take this today. I'm just tired. I'm going to take only this. So that non-compliance to medications occurs. Okay, so when they are non-compliant, they tend to increase hospitalization rates because they don't take their medication according to what they are prescribed with. Okay, and then increase treatment costs as well. You have to admit yourself, more medications, more consultations. It gets very complex.
Yeah, my mother has to listen to this. she will self-diagnose all the time. Well, but anyways, I do understand this is a major risk, because from some of the other interviews that I've had is overdosage or underdosage can increase risk unnecessarily, and especially if you're running the gamut of polypharmacy over here, you're running 4 or 5 medicines, then what does underdosage do? What does overdosage do? Because you've already calculated everything, you've already given them a regimen, but then if they don't follow the regimen, what happens?
Yeah. Okay, so as what I said just now, medication errors, example, they can wrongly calculate the dose, repetition of the dose, and not only that, there's another thing where they take it once it's expired, because the storage conditions. Yeah.
True.
So there are certain medication that need to be kept away from light, you know, in a black medicine envelope, but they are not doing that. Okay, so that is one thing. So when they still consume this medication, it can lead to severe damage. And then there can be fatal consequences. You never know when you're admitted what might happen.
Yes, the risk, although minute, but it's always there.
Yes, always there.
Always there. All right.
And then you can see medication errors higher in elderlies. Why? Because they have decreased vision, decreased hearing, forgetfulness. So if they don't have a proper caretaker for them, things might go ugly. Yes.
Better get them like that pill box and with timer and all of that.
Yes, that's another initiative that can be done. Okay.
All right.
And then there will be also another factor, seeking treatment from several healthcare facilities. So as we know, we go to hospital A, okay, we got all the medications, but our mind is telling, it's okay, let's get a second opinion. So we go to healthcare facility B. So the doctor is going to prescribe you with more medications. So it all juggles up, becomes more complicated. Patient might take maybe the same medication, just different brands, different shape and color, because sometimes the facility carries different brands as well, and patient is not aware of this. Okay. And then polypharmacy can also increase non-compliance in a patient. For example, like how I mentioned before, a patient will be confused, not taking their medication at all, maybe. Yeah, you never know, because sometimes they don't store it properly. Which one is for morning, for afternoon, night. Yeah, so non-compliance is really an issue, especially among elderlies. Okay. And then next will be interaction among medications. Okay, so usually to start a treatment, doctor will first evaluate whether, okay, can you be on this medication? So as a patient, we have to be really direct with our healthcare practitioner. If we are taking any supplement, any non-registered product or anything, it's okay. Health practitioner won't judge you. You need to tell.
Or report you to the police. Okay.
Yeah, because the risk of interaction is always there. It can be very harmful. There's been many cases of harmful interactions like that.
True.
Yes. Okay. And then it can also make the drug less effective. Example, they are taking medicine A and B. So A might make B less effective, or B might make A less effective.
And there's numerous drugs that do that.
Yes, correct. That is why it's very important to be very clear with our healthcare practitioner, to be our pharmacist, talk to them and tell them what are we taking at home, what is there, supplements, any products that maybe we buy online. Yeah, because now there is so much of products online as well.
Yes, but please don't buy them. Especially with medicine.
Yes, because
so,
it can,
can I ask, if even if it's something as simple as vitamin C pills, do we still tell the...
Yes.
Oh, okay.
Believe me, vitamin C also has many interactions with other medications.
That is interesting to hear.
So whatever it is, it's a simple pill, but you have to tell to the doctor.
Right, because sometimes... this has personally happened to me. I've told my mother, make sure that you tell the doctor exactly what you're taking. And because I couldn't be with her, she did not tell them, because she said, this is simple medicine only. Why not? Like, this is just for me to feel better in the morning,
Okay.
just a boost. I'm like, Mom, This is something you need to tell them, because we don't know. We are not doctors. We don't never studied for this and stuff like that. But as you said, that sometimes the elderly, especially with the issues of non-compliance, can be quite an issue. Yeah.
Correct. So medicines. So of course, interaction can cause medicines change in their absorption, metabolism, excretion. So there's a lot to that, and also affect their potency, how well they work in a patient. So we might want one effect to occur in a patient, but the reverse will be happening in them. So every time they come for their checkups, it doesn't seem to work out for them. It's always misaligning with their health goal. So yeah, that is about polypharmacy.
All right. So I think you've touched a bit on the risk and who is at risk, but maybe you could tell us who is at risk of polypharmacy and why.
Yeah. Okay. So as I mentioned just now, it's more common among older adults. Of course, you in this world, only young people can still have polypharmacy, but it's very common, more common in older adults because they have many other comorbidities. They can have asthma, arthritis, chronic lung disease, diabetes, hypertension, you name it, it's there.
Okay. We are Malaysian, definitely.
Yeah. Okay, so when adult age 65 and older, they tend to take more medications than normal
the younger
adult. Yes, correct. So these patients are at risk for adverse effects. That means a very harmful side effect. For example, they have more than one type of illness that require treatment. They are taking herbal medications, that's what we mentioned, vitamins, general medications like over the counter, maybe they get it from the pharmacy. Okay, taking unregistered medicines along with control medications. So unregistered will be those that you can get easily from just social media and everything. You can purchase it quite easily.
Irresponsible sellers.
Okay, and then they're saying more than one doctor or pharmacist for treatment advice. Like I said, multiple healthcare facilities. So you just juggle up everything. Okay, having vision or hearing problems. Okay, older adults. So it's difficult for them to read labels or listen to the instructions. Even when they come to the pharmacy, we will tell them everything, but they will be like, yes, yes, yes. But when they go back home, it will be totally opposite. Okay, having illnesses such as forgetfulness, or maybe they're living alone without a caregiver. Yes.
True. All right. So the elderly are at risk, and you know what? Even sometimes, especially in the current fast-paced world, right? Like even me, if I had to take more than 2 medicines at a time, even I lose track what I'm taking. Especially when you're sick, because you got your Panadol and your whatever that keeps you. Like for instance, if you're having the runs or something, then you have your vitamin C, this like that. I will definitely lose track. So I think we need to come up with like a AI powered system or something for that. I don't know. But you know what? We do have more to talk about. We've got we're going to be coming back and talking about tips that should be practiced by patients. I think this would definitely be helpful. And also, how can polypharmacy be avoided? So these are the things that we're going to be talking about. But right now, let's listen to this one. We will be right back after this. If you do have questions, you can send them to our TikTok page, and if it's pertinent to the current interview, we'll be more than happy to talk about it. We are currently talking to Jasrinjeet Kaur, who is a pharmacist with Cyberjaya Hospital, and we will be right back. Don't go anywhere. Welcome back, and today on Health on Traxx, we are speaking about polypharmacy, how to manage multiple medicines safely with our guest, Jasrinjeet Kaur, and she's a pharmacist from Cyberjaya Hospital. And Jasrin, what are the tips that should be practiced by patients who need to take various types of medication?
All right. So, if let's say a patient needs to take various type of medications, so some of the initiative that can be taken, first of all, maybe they should stick to getting treatment from one facility only. Okay, because or maybe obtain their medications from one facility only.
I mean, you can get multiple opinions, but
Yes.
only get your medicines from one place.
Yes, correct.
Okay.
Okay, so if it's necessary for them to go to another facility, they should bring along with their updated prescriptions, list of medications. They can carry with their medication along so that the health practitioner can actually have a look and they won't prescribe the same medication again for them. Okay, so no repetition of medication then. Okay, so next will be to keep the prescription properly. And then will be to record all the medications taken. They can actually make a list. Morning, what I'm taking. Afternoon, after lunch, before lunch. Including their supplements, herbal medications. So that will be very helpful. And next will be to inform the doctor or pharmacist if they are currently taking any other medications. As what we know, drug interactions is what we fear the most.
Absolutely.
All right. And then next will be to always read the label, follow the instructions, because sometimes they tend to be like, no, this is just my normal medication. I'm just going to eat it. I don't need to look at the label. But sometimes doctor do change the dose from half tablet becomes 1 tablet or 1 tablet becomes 2 tablet. So they tend to miss to read and follow the instructions.
Yes, and especially in the government hospitals, it's very hectic. So sometimes
Yes.
even the pharmacist wouldn't have the time to let you know that the
Correct.
dosage has been changed, or
Correct.
especially for people with high blood pressure. If over time it becomes regular, then they do decrease the
Decrease the
dosage.
dose.
And if you still maintain the same dosage,
Yeah.
that's going to be problem. Yeah, please do continue.
All right. So the next will be to keep the medicine in original packaging because, yes, now we do have pill box, but what they tend to do, they tend to open their pills from the blister and store it accordingly, and then they don't tend to recognize it. What was this pill for? Yeah.
Everything looks the same. It's all white color
Yeah,
tablets.
Correct. So actually for older adults, we suggest to keep it in the original packaging.
Which-
Just take whenever you need it and put it back there.
Yeah, and it's much safer there. No risk
Safer.
of contamination, no risk of
Correct.
exposure.
Correct. Yeah, because certain medication can't be exposed to light, air. Yeah, it's very sensitive. The potency will decrease.
Understood.
Okay.
Understood.
All right. And then the last point will be very important to avoid buying medicine from illegal sources. Social media now, Facebook, TikTok, Instagram. This pill can make you thin in 10 days. Wow, that's such a miracle. And they actually take it and after that they suffer from the harmful consequences.
Yeah, actually, those work, in 10 days, except they have to cut your leg at the end of it. So that's the weight you lose.
Definitely.
All right. So, okay. So those are some of the things that, especially patients who know they have to go through polypharmacy, those are the tips that they need to practice. How can you avoid it though? Of course, they always say prevention is better than cure. And how can polypharmacy be avoided? Can you share some tips to help prevent problems caused by multiple medication interactions, especially as you said, the target group being older patients?
Okay, so the main point will be to always discuss with the pharmacist or doctor. So as you see, I've been stressing this point from earlier on, okay? Because any health supplements for self-treatment can also cause drug interactions with their prescription medications. Okay, so be very clear with the pharmacist. If you're scared from your doctor, tell to your pharmacist, we won't eat you, don't worry.
Yeah, pharmacists are always very nice.
They are very nice,
Yes.
actually.
Yeah.
Patients are also advised to bring all the medication taken in the original packaging. Every time they have their checkup, bring your medications along. Yeah, just keep them in the original packaging so that, it's better. Monitoring will be very good in that sense. All right. So the next one will be to read medicine labels carefully before taking the medications. Okay. And then to seek medical attention immediately if they experience any side effect, any unwanted effects that they feel like, okay, this is not normal. So just go to your medical facility immediately. All right. And then do not stop taking prescribed medicines given by the doctor even when you're taking other health products, because what doctor has given you should be taken for that duration. If you just stop it abruptly, there might be other side effects, consequences. Your disease might progress, comorbidities might increase.
Yes, especially things like antibiotics always run the course.
Yes, always run the course. Okay, and the last one will be during counseling consultation sessions. Actually, now we are more towards patient oriented. So patient's involvement is very important. So I suggest all the patients to always tell to your doctor, what do you feel? You feel like this medications is a lot for you? We can help you. We can maybe give you combined pills. Yeah, now medicine is really very advanced. So there's a lot of pills that they have two medicine combined in one. And also talk to your doctor. We want more patient involvement. Yes.
So maybe there's a high blood pressure and a diabetes medicine together, and it's called the Malaysian edition. Since that seems to be the most prevalent disease in Malaysia.
Yes, correct.
All right. Is there anything else that you would like to add to that?
Okay. Actually, for that, the patient involvement, any additional information such as any herbal medicine, traditional complementary medicines, all should be identified, given to the doctor and pharmacist so that they can actually advise you accordingly. It's not that you can't take them, but at least follow the advice when you should take them. Do you need to take them at night? Do you have a gap between 2 hours between other medications? So that is very important.
Because that is... we need to refer to the specialist, to the professional, especially if something as important as putting it into you.
Yes.
Yeah. So please always refer to either a doctor or a pharmacist to make sure that you know exactly what needs to be done. And what should they do if they suspect a medication interaction or side effect? I think you did touch on that. Would you like to elaborate?
Yes, correct. So if they suspect any side effect, of course, the first step will always don't just wait at home, go to your nearest medical facility, seek treatment, bring along all your medications, okay, and tell them what do you experience. And it's best for you to tell like how long after you take the medications that you got the effect. Is it 2 hours, 3 hours? So when did you last take your medications?
Okay.
Yeah, so all the information. If they are not able to tell, there should be a caregiver with them. Yes, so it's very important to list their medications. They take it at one time, before lunch or after lunch, and all that is very important. Yeah.
All right, understood. Okay, we're going to be taking another short break, and this song was requested by your colleague. And I think, is it for... Oh, yes, by your colleague. All right, we're going to say that. And we'll be right back after this. And we are still talking about polypharmacy. Once we come back, we're going to be talking about how caregivers or family members can support patients. And also Jasrin's final advice for today. And this is Jason Mraz's Lucky, right on Traxx. Anyway. welcome back. Lucky, Jason Mraz and Kobe Kaire right here on Traxx. We are talking to Jasrinjeet Kaur, and she's a pharmacist with Cyberjaya Hospital. We are talking about polypharmacy, how to manage multiple medicines safely. It is a very interesting topic, especially for the elderly, and especially since in Malaysia, a lot of people seem to have a lot of different kind of diseases at the same time. So this is a very pertinent interview for today. Today, we are also going to be talking about family members and caregivers supporting patients managing multiple medications. How can they do that?
All right, thank you so much. Okay, so as a caregiver, how can we support them will be sometimes our parents do stay alone and all. So even if we visit them, it won't be very frequent. So what we can do is help them whenever they get their medications. Yes, we can help them to sort the medications in the pill box. So, but what do is, we don't take out from the tablet from the blister itself. We can cut along the blister. Okay, keep it just one tablet like that. So in that case, it's not removed from this packaging. Okay, and then secondly will be, we can set alarms for them. Yes, so that they don't miss their doses.
True.
So alarm in the morning, alarm in the afternoon. It's okay, it gets annoying, but they have to take their medication.
You go on vacation, alarm goes on all the day long.
Yes, correct. But it really helps. Yes,
True.
it really helps. And then will be to sort their medications. Like I said, list down their medications for them. Go with them during their checkup so that you know what is the update on their health. Sometimes they go alone and they don't tend to understand what the doctor or pharmacist explains
Yes,
to them.
it is true. I think like even in this fast-paced world, taking the time to make sure that your parents know, and you know what your parents are going through. Now that is the simplest of things that you can do,
Correct.
and you need to do it.
Correct.
I mean, as a pharmacist, you might have seen a lot of older generations coming through and not being able to understand exactly what's happening,
Yes,
and that,
correct.
to be frank, that is quite heartbreaking.
Yes, very heartbreaking.
True. Please continue. We went sideways for a bit there.
No problem. So actually, that will be it. Setting alarms, listing their medications, pill box, and then going with them for their checkups. So an emotional support anytime they want.
That is true.
Yeah, that's very true. Correct. That's all.
Okay. All right. Thank you so much, Jasrin. Now, before I let you go for today, is there anything else that you would like to add on, like sort of a final advice or a take-home message for our listeners today?
Okay, so polypharmacy is a very significant public health challenge in our fast-paced world now because it increases the likelihood of adverse effects, increased treatment costs, increased hospitalization rate. So inappropriate polypharmacy is becoming increasingly common, especially among the elderly, 65 years and above. Okay, and those who having complex health problem. So they tend to refer to several different doctors or pharmacists to seek treatment. So this group is more vulnerable to polypharmacy.
Understood.
So as polypharmacy, it has its risk, it has its benefit. Okay, if it's aligned with your health goal, it's good. But if it's unnecessary, it brings harmful side effects. So patients are always advised to discuss with the doctor or pharmacist for optimal treatment options. Okay, patients also need to be extra careful in taking their medications and practicing proper medication intake to avoid unwanted problems. So in case patients they want to know more, they can actually call National Pharmacy Call Center, NPCC, at 1-800-886722. It operates from Monday to Friday from 8 a.m. to 5 p.m. except on public holidays. Okay, so it's always there. You can always ask them questions. Or if it's out of office hours, you can actually go to nearby medical facility, talk to the pharmacist, talk to the doctor. They're always ready to help.
And they're always on site, so weekends also, no problem. Just go.
No
Ask.
problem, yeah. And one more thing that I would like to add on, now everyone have smartphones. Okay, they can actually update their phone with this app called NPRA, National Pharmacy Regulatory Agency, NPRA product status. So they can actually check the status of medication registration. So if you buy it from online, you want to check whether it's registered or not. It's as easy as putting the name into the app and checking it. If it's showing the unregistered, you should report it.
Yeah, don't use it.
Yes, correct.
Okay, now thank you so much, Jasrin, for taking the time today to talk to us. I mean, you say it is your first interview. Doesn't sound like it. You sound like a seasoned pro.
Thank you so
And
much.
we'll have to have you here again in the future. And of course, before we end, I would just like to tell our listeners, we spoke about polypharmacy, how to manage multiple medicines safely. We spoke to Jasrinjeet Kaur, and she is a pharmacist with the Cyberjaya Hospital. And before we end, now this is something that we don't usually do, but this is a request from from her better half, Karthik Kandavel, and he wants this song for her. So enjoy with that. It's about time that we close down Health on Traxx. We'll be back next week, but right now, here's some music to go.